Hi everyone. Today we summarize the general concepts of the trigeminal nerve. The trigeminal nerve is the largest of the cranial nerves and has a mixed function. Sensory, which is the most important, collecting sensation from the face, the teeth, the meninges, and part of the tongue. Motor, which innervates the muscles of mastication and swallowing. It originates from the pons and, inside the skull, extends to an expansion that contains only the cell bodies of the sensory neurons called the Gasserian ganglion, and here it divides into three branches. The ophthalmic branch, which is sensory and innervates the skin of the forehead, the scalp, the cornea, the conjunctiva, and the meninges of the anterior cranial fossa, and passes through the superior orbital fissure. The maxillary branch, also sensory, innervates the skin of the cheek, the lower eyelid, the palate, the upper teeth, and the meninges of the middle cranial fossa, and passes through the foramen rotundum. The mandibular branch, mixed, sensory for the mandible, lower lip, tongue, anterior 2/3, general sensation only, lower teeth, and meninges, and motor for the muscles of mastication, masseter, temporalis, pterygoids, the tensor tympani, the tensor veli palatini, the mylohyoid, and the anterior belly of the digastric. It passes through the foramen ovale. So, all these are afferent components that go from the periphery to the Gasserian ganglion and then to the pons, except for the motor component of the mandibular branch, which goes from the center to the periphery. Since the Gasserian ganglion contains only the cell bodies of sensory neurons that transmit information about touch, pain, temperature, and proprioception from the three branches of the trigeminal nerve, where do the motor fibers in the mandibular branch pass through? The motor fibers of the trigeminal nerve have their cell bodies in the motor nucleus of the trigeminal nerve, located in the pons. They bypass the ganglion and join the mandibular branch directly. The trigeminal nerve is also used by other cranial nerves, through autonomic ganglia located in the skull, as a pathway to reach organs such as the eye, lacrimal and mandibular glands, and the parotid gland. It is thanks to the ophthalmic branch of the trigeminal nerve and then to the facial nerve that we are able to automatically close the eye when the cornea is touched. Even if only one eye is touched, both eyes close, because signals from the trigeminal nerve are transmitted to both facial nerve nuclei.